what sort of innovation do you see coming? So now you've got a less invasive approach, which you've extensively used. What do you think is next to that?
Well, very interesting that you brought this up because I've been in an era where I could see the progress in minimally invasive surgery. You see, minimally invasive surgery started somewhere in the late 90s,
Yeah.
sorry, late 80s.
Yeah.
89 was the first laparoscopic hysterectomy in the United States. We did our first laparoscopic hysterectomy in 1993.
Right.
We did the first course in laparoscopic hysterectomy in 2003, which I happened to attend. And at that point, we were using what was known as the 2D system.
Yeah.
Now, a two-dimensional system.
Right.
Now, the human eye is able to see in three-dimensional vision.
Yeah.
It took the companies about the company which produces systems almost about 10 years to be able to put that into 10 millimeter scopes. Almost about 10 to 15 years to come into three-dimensional imaging.
Right.
Robotics is about three-dimensional imaging.
Okay.
So these are what we call we had the first generation systems where we were operating on direct vision using a view through the laparoscope. Then from the direct view, we went to video laparoscopy, projecting that into a view so that the other people would see. And then we learned two-dimensional systems. Now we've come to three-dimensional systems. And the fourth generation now currently is the three-dimensional 4K system, which is robotics technology.
Okay.
Laparoscopy is what we call counter-intuitive systems. That means you got to fight against your brain to do laparoscopic surgery, which is why it's, in order to move right, you got to actually use your left hand.
Yeah.
In order to move
this is that I
left,
yeah.
I got to use my right hand. So the laparoscopic surgery became what is counterintuitive. Now the robotic surgery has overcome that. So it's what we call intuitive surgery. If you move right, you're actually moving your right hand. If you're moving left, you move your left hand. So it's a faster learning curve for the younger surgeons, I must say. So if you're not a surgeon who has done laparoscopic surgery, if you're a very junior surgeon in your 30s, you've done open surgery, and robotics is probably the way to go because it will be easier for you to learn this minimally invasive approach.
Yeah.
Because
without getting too convoluted with your...
Correct.
Yeah.
With the mind.
Yeah.
You got to train your mind. Now, having done this for 23 years, have to unlearn what I've learned.
Oh my goodness.
To go into robotic surgery. Although it's easier for me because I know the basics of it.
Yeah.
But I must say, robotics is coming in a big way in a lot of the regions.
Yeah.